It's okay not to be okay.
It's okay not to be okay. That's a perfect song for this story. Only on CBS This Morning. Very nice, Stacey. We're taking you inside a pioneering program to help healthcare workers on the front lines of the pandemic build resilience. Now, this may hold lessons for all of us. We spoke with nurse managers at New York City's Mount Sinai Hospital about how they say the program has helped them heal. Our senior medical correspondent, that's Dr. Narula, she's here at the table in person. We get so excited to take a look at the science of resilience and why experts say we should all be hopeful about the future. Tara, remember when you did the first story about how medical workers were struggling?
Yes.
It never occurred to me about the burden that they were facing. This was early on.
I know.
This is so important. It still continues.
So this is such an important story. For those of us who've ever wondered if we really have what it takes to bounce back from difficult times in our lives, experts I spoke with say the proof is in the science. I sat down with 3 nurse managers from Mount Sinai here in New York who just completed a resilience workshop they say has transformed their lives. Summer is here, marking a new beginning for Benson Cahio, Jenny Drexler, and Chimena Corena. All 3 are nurse managers at Mount Sinai in New York.
Was there anything in your past that prepared you for what you faced with COVID this past year?
I have been a nurse since 2005. 2020, I would say, was the most difficult in my entire nursing career.
A few years ago, if you told me that I would be doing this, I would say, there's no way that would happen.
And you just fight and do what you have to do to survive.
We told them, right?
After over a year on the front lines, they've just completed a 5-week-long resilience workshop. It's the first of its kind, created specifically for healthcare workers fighting the war on COVID.
You all obviously went into a field where your entire focus is on taking care of someone else. Sounds like from this workshop, many of you learned how to take care of yourselves.
We learned a lot of coping skills. Look at the good in every situation.
Live in the moment, which is something that I struggle with every day.
We're fighting this virus. It's a fight. We saw what was happening. We needed to respond urgently to take care of our healthcare workers.
Dr. Dennis Charney has studied POWs, Navy SEALs, and victims of trauma for decades.
This is where the interaction is.
At the height of the pandemic, he created the Center for Resilience at Mount Sinai.
The brain is what we call plastic. The more you use it, the better it functions. The brain actually changes for the better when you work at things like becoming more resilient.
What have you seen in the imaging studies that you've done?
There seems to be a more enhanced relationship between the emotion parts of the brain and the cognition parts of the brain. They seem to work better in concert when you're under stress.
For a lot of people, they think resilience is sort of psycho mumbo jumbo babble, but what you're saying is there's actual science there where you're changing the neurochemistry and the functioning of the brain.
That's right.
But how do we train our brains to become more resilient? Practice, says Charney.
You're training yourself in all aspects of your life. So when you face another trauma, you say, I'm equipped.
And the key equipment, says Charney, is accessible to us all. Building strong connections, creating a sense of purpose, and an optimistic outlook are all characteristics of resilient people. We've heard it called a toolbox or a toolkit.
I call it a psychological toolbox.
And you can pull out the elements that you need when you face the next challenge.
That's right. And we've seen that over and over again.
When you look back, do you believe that what you went through will prepare you now for challenges that are to come in the future?
Bring it on.
Absolutely.
You never think you're strong till you go through it and get through it.
And you look back and you realize how far you've come.
Dr. Charney hopes their program can also be applied on a larger scale beyond the hospital setting into communities that have been deeply affected by COVID-19 and the events of the past year.
Fascinating, Tara. I think we could all use a resilience workshop. Thank you for that.